Okay, everyone. Um, Having said about the structures of the female reproductive system, I want to believe you have understand a little. Don't forget, we are still talking about a physical pathway that connects the vagina to the abdominal cavity. Today, we are going to talk about the health implications of these particular substances that can get into you through your vagina. One, we have the infection risks. This infection risk is actually exposure to pathogens that can cause some diseases into a woman. So, one, the infection risks can cause pelvic inflammatory disease. This is known to people. I may not go deep into that explanation. So, it can also lead to severe pelvic pain. That's the infection. It can cause infertility due to tubal damage. If there is infection, especially ascending infection, it will go through that particular pathway I mentioned earlier, the vagina, cervix, through the uterus. It will go into the fallopian tube and causes some damage, infection. So it can make some adhesion, making a kind of damages in the tube. So if it makes that particular damages, it can make the tube not to function very well. And as a result of that tubal damage, it can cause to infertility. That's why we most at times say that infection, popularly known as toilet infection, can cause infertility. So it's actually beyond just you being exposed to infection from your vagina. So it goes upwards, pass through that particular pathway I mentioned, and it will damage the tubes, causing infertility, severe pelvic pain, also a chronic pelvic inflammatory disease. I will continue to talk about the implications of these particular substances that used to pass from the vagina into the abdominal cavity. This is not really the message. So follow, like, and share for the continuation of this particular knowledge I'm trying to pass across. Thank you very much.